Mechanism of brain injury. In head injury, brain may be injured by two ways: by direct intrusion, brain injury by foreign object like a penetrating weapon, bullet, or fragment of skull fracture is obvious. By deformation of brain in closed head injury, injury to brain is caused by change in velocity, either acceleration or deceleration, in axial or rotational direction, when in either case of acceleration or deceleration, brain may be damaged by compression of constant unit by their being together, tension of unit which pulls them apart, sliding or shear strain which moves adjacent strata of tissues laterally. In either deceleration or acceleration mode, skull and brain cannot change their velocity simultaneously, and the brain will speed up or slow down only by virtue of restraint provided by the suture receptor and configuration of the interior of the skull. This restraint will occur first with the maximum effect on superficial layers of cortex. Thus, in turn, will drag on the next deepest layer and so on until difference in velocity is equalized. This occurs at expense of a laminar tearing of the cerebral tissues and its associated blood vessel. In addition, shearing will force a brain against the sharp edges of temporal opening and lower edge of the falx, causing damage to base of the cerebrum, corpus callosum, and brainstem. Impact against slides of skull and against falls may cause a diffuse condition of brain. So, by deformation, closed head injury, injury to brain caused by change in velocity, either acceleration or deceleration, when in either case of acceleration, damage, compression of constituted by two other, tension of unit, sliding and shearing strain, skull and brain cannot change their value simultaneously. Brain will speed up or slow down. First, maximum effect on most superficial layer of cortex, thus in turn drag on deepest layer. This occurs at expense of laminar tearing of the cerebral tissue and associated blood vessels. In addition, shearing will force the brain against a sharp edge of tentorium opening, lower edge of the falx, causing damage to the base of the cerebrum, corpus callosum, and brainstem. Back against the sides of skull and falx may cause diffuse condition of brain. Epidural hemorrhage. Epidural hemorrhage is an intracranial hemorrhage, also known as extradural hemorrhage. Skull dura, middle meningeal artery, extradural hematoma. This is a fracture middle meningeal artery bleeding between skull and dura mater. Etiology: between inner table and this inner table of the skull and dura mater inner table of skull. Almost always traumatic for road traffic accident. Bleeding from rupture of diploic vein, venous sinuses or meningeal artery. Most commonly middle meningeal artery. Most common in adult, usually on a side of impact, and mostly unilateral. Show limitations due to dura attachment at its suture lines, associated with a fissure fracture. A large circumscribed ovard or disc-shaped blood clot, 2 cm or more in thickness in extradural space, lead to rapid compression of brain, leading to fatal involvement of vital structures in the middle. Acute within few minutes to few hours or even in a day. Arterial bleeding. Chronic, slow in onset, 48 to 72 hours after trauma. Rare and commonly associated with a tear of venous structures. Clinical features: initial injury to brain causes unconsciousness due to concussion. Dilatation of the pupil on side of hemorrhage with a conjugate deviation of eyes to opposite side. Bilateral fixation of pupils. Lucid or latent interval. State of unconsciousness between two episode unconsciousness mechanism. After initial loss of consciousness due to concussion, patient may recover, but a subsequent middle meningeal bleed causes decompensation from expanding blood collection, causing increased intracranial pressure and reduction in cerebral perfusion. Secondary injury: features of cerebral compression and coma, decerebrate rigidity, and death due to respiratory failure. Medical legal importance: extradural hematoma is a surgical emergency and prognosis is good with proper treatment. Condition resembles drunkenness. Thank you.